This program is brought to you by the Neely School of Business at TCU, Community Trust Bank, Medical City, and Bid Select. Welcome to Platforms, the life-lifting news program for women. Now, here's your host, Siobhan Palmer.
Welcome back, everybody, to Platforms. I'm Siobhan Palmer. I'm continuing my conversation with Dr. Janardhan, who is the director of the Texas Stroke Institute here at Medical City, Dallas. And Doctor, recently in the news, Vice President Joe Biden's son, Beau, suffered a mild stroke. And this is a guy, you know, a veteran, looks like he's in great shape, 47 years of age. So do strokes impact all ages?
That is a wonderful question. Traditionally, our thoughts are that brain attacks and perceptions are that brain attacks occur only in elderly people, and so is our perception with patients with heart attacks. But what is happening is that with the prevalence of more and more of risk factors and with busier lifestyles and the fact that we don't have as much time to take care of our health, that brain attacks are occurring in younger and younger people. And so it is crucial, as we discussed earlier, that we identify all the modifiable risk factors that could possibly be running in our family as well as in each one of us, and actually take our efforts to take care of that. It's more like a car who needs a regular checkup.
Absolutely.
So it's like a health maintenance checkup to make sure that we have covered all our modifiable risk factors. So the answer to your question is yes, stroke, brain attacks can occur in both younger people as well as older people. There are some types of strokes that traditionally occur in younger people, but there are also the type of strokes that happen in older people that are occurring at earlier and earlier ages now because of the prevalence of risk factors in the younger population also.
What is the association between an extremely stressful lifestyle and the incidence of a potential stroke?
We haven't truly been able to define stress levels and link it as a causative factor for brain attacks. However, it's a risk factor that kind of implies that you don't have the time to check your blood pressure, you're having a poor diet, you don't have the time to be able to exercise and take care of your activity levels, your sugar levels may be off and your cholesterol levels may be off. And so stress is a factor that needs to be controlled, whether it's meditation or doing laid-back activities like listening to music or going on long walks with your loved one. Whatever the relaxing factor in each one of our lives are, we should try to do that to decrease stress, just so that it gives us more of a time to correct all the other modifiable risk factors.
Absolutely. Let's talk about, we talked about the two major types of strokes. Let's go into more detail about treatment for the bleeding type strokes that you had mentioned earlier.
So just as we had talked about blockage type strokes, where you have a blood vessel supplying blood with nutrients, oxygen and glucose to the brain blood cells, if those blood vessels were to burst, then what we would have is a bleeding type stroke or a hemorrhagic stroke or a bleeding type brain attack that actually causes the brain cells to die because they're drowning in the blood. And so this can happen with what are called brain aneurysms. So a lot of you might have heard in the news that there are several celebrities who've had brain aneurysms that have ruptured.
That's Bret Michaels, recently in the news.
Had one such type of stroke, and Sharon Stone had a bleeding type aneurysm. Actually, Vice President Biden had a bleeding aneurysm when he was younger, and so there are a lot of people in our day-to-day lives, as well as people in the forefront in different fields who have had these conditions affect them. And what happens is that these brain aneurysms need to be treated, and traditionally in the past we would do open brain surgery to be able to go in and put a surgical clip across the neck of the aneurysm. And since the 90s there have been development of devices to be able to do this minimally invasively without having to use any incision or suture. We go in through the leg blood vessels, navigate up to the brain blood vessels, and place these very tiny spring-like platinum coils into the aneurysm and softly place them so blood no longer goes into the aneurysm and the aneurysm gets disconnected from the parent vessel. So it's just one of the ways in which new catheter-based therapies and endovascular techniques have really revolutionized the way we take care of these people. Another cause of bleeding type strokes or brain attacks is just uncontrolled high blood pressure. So if you have extreme uncontrolled high blood pressure, you can visualize that it could potentially rupture the blood vessels, and so it's important to control the blood pressure.
You know, one thing I've always wondered, because I know sometimes that heart attack symptoms manifest themselves differently for women than men, and because our core audience are women, is that the same case relative to the symptoms of a stroke?
That's a wonderful question, and that is true. In terms of heart attacks, some of the symptoms of heart attacks can be blunted or can be in not the traditional ways when it comes to women, especially diabetic women. And with brain attacks, we don't have that same distinction because each of the brain cells in different locations have specific functions, and so if that part of the brain were to be affected, you would have those symptoms. So we have a language center, and if that's affected, you would have problems communicating. If it's the motor strip, which controls strength on the opposite side of the body, you would lose arm and leg strength. And if it's in the sensation part of the brain, you would lose sensation. If it's in the vision center of the brain, you would lose vision. So depending on the location of the brain that's affected, you would have those symptoms. However, with women, there are certain risk factors that are unique to women that are not present in men, or not such a significant risk factor in men. And some of them is women who deliver after pregnancy, they have a tendency to be dehydrated and also have a tendency to make their blood a little on the thicker side, on the venous side. So we have arteries as well as veins. So there are blood vessels carrying good blood to the brain called arteries, and then there are blood vessels carrying bad blood from the brain back to the heart called the veins. Not only can you have a blockage type stroke because of a blockage of an artery, you can also have a blockage type stroke because of a blockage of the vein. And so in the post-pregnancy period, as well as in very young children who there are events that can make you dehydrated, there is a risk of increasing the viscosity of blood and creating venous type strokes called sinus thrombosis. In addition, oral contraceptive pills have been studied in a big way to be associated with deep venous clots in the legs. Again, those are important to review and see whether they're to talk to a primary care doctor to see whether those are relevant. And lastly, there are a risk factor called anticardiolipin antibodies, which is a blood test. And one of my areas of research was at Framingham Heart Study in Massachusetts, wherein we found out that anticardiolipin antibodies are a novel risk factor for stroke in women, but not so much in men. So as you can see, there are some gender-based differences.
Dr. Janardhan, fascinating conversation. We're going to have to break, but when we come back, we'll continue our conversation with Dr. Janardhan. This is Siobhan Palmer with Platforms, the life-lifting news program for women.
The Texas Stroke Institute is dedicated to compassionate, multidisciplinary, and quality care for patients who suffer stroke and disorders of the head, neck, brain, and spine. Physicians at TSI offer patients cutting-edge treatment options for neurovascular disorders, including minimally invasive catheter-based therapies for adults and children. TSI encourages academic and research excellence, community awareness, and prevention education. The Texas Stroke Institute is a collaborative initiative that includes 11 North Texas HCA hospitals. The goal of TSI is to develop an effective and resource-efficient plan to reduce the morbidity, mortality, and economic burden of stroke in the region by incorporating medical education and participating in research. Texas Stroke Institute physicians practice multidisciplinary medicine to drive best practice in patient care. Their vision is to become the first system in the North Texas region to offer multi-facility comprehensive stroke care. Texas Stroke Institute, Dallas, and Plano. For more information, visit texasstrokeinstitute.com.